Medical Education Grand Rounds of the 2011-12 academic year. I'd like to update you on what's going to happen for this fall, encourage all of you to invite those you know who might be interested in the MedEd Grand Rounds, and then I'll introduce the speakers. So next week we actually have Dr. Salvatore Mangione, who comes from Jefferson, and he's going to talk about physical diagnosis. The title is Augenblick, Famous Physicals in History. And in fact, Augenblick was one of the most popular and beautiful German words in a poll because it actually is longer than what it means. It means in a moment or a very brief period of time. And then we have two updates of the AAMC conference. Many of us are going to that. The first will be November 16th, and the second will be December 21st. And then in between, we are lucky to get Dr. Sheila Chauvin. She's coming from New Orleans. She's at LSU, and she's not only going to give a medical education grand rounds, but she's going to start the first two workshops of our MERC series, Medical Education Research Certificate series. So her grand rounds will be on how she developed a template through a grant to locate and retain community clinical sites for both medical students and residency education. And she will provide that template for us. Our medical education grand rounds today is Conflicts of Interest in Medical Education, Waking a Sleeping Dog. It's my pleasure to introduce both Dr. Deb Korenstein and Andy Mumm. Dr. Korenstein received her bachelor's degree from the University of Pennsylvania, her medical degree from Columbia, and her internal medicine residency at BI in Boston. She then came to Mount Sinai. She's been here for 14 years, and she is okay. Next year will be 15. So she's an associate professor in the Department of Medicine. She's also the director of the primary care residency. She's the associate program director for the internal medicine residency, and she's the director of education for the Division of General Internal Medicine. It's been my honor to work with her jointly on, we had an Oregon State Attorney General grant that's, I think, relevant to probably what you're going to talk about. The grant was entitled Data Smog and Marketing Fog, and we developed a curriculum at the UME and GME level on conflicts of interest with the pharmaceutical industry. She also is very interested in evidence-based medicine and directs EBM for the internal medicine residency, and she's received multiple teaching awards. We are lucky to have Andy Mumm as well, who is a third-year Mount Sinai student. He got his bachelor's degree from Columbia, and he has done not only basic science and quality of care research, but he's also done global health research. He was in India this past summer looking at the vaccination rate and opinions and beliefs about vaccinations in rural India. I'll turn it over to Deb first.
I probably don't even need a microphone. Oh, but you're recording. Okay, sorry. I have a very loud voice, so I definitely do not need a microphone. How do I get out of this chair? That's all right. I'm here. No, I don't have to do that. Okay. So thank you for that introduction. I can't believe how long I've been here. That's a little scary. Can you advance the slides? So I just want to acknowledge everybody else who's been involved in this project, which has been a really fun project. David Muller, who I'm surprised isn't here, sort of asked us to speak today. Azalea Kim, who's now a sort of fourth year-ish, is she officially, she would be a fourth year medical student, but she's at Harvard getting her MBA, so she was instrumental in this project. And also Alex Steinerman was involved in the design of it, and Robert Feller did our statistical analysis. So I call this waking a sleeping dog because of the phrase, let sleeping dogs lie. And I think we're sort of maybe opening up a Pandora's box on what disclosure really means. So that's what we're going to talk about today. Go to the next slide. So I have no conflict of interest to disclose. And as Erica said, I got interested in this topic of conflict of interest after we had this Attorney General grant a bunch of years ago, and I've done more and more. Oh, I just badmouthed you, and here you are. And I've done more and more work on that since then. So that's what we're going to talk about today. So these are the objectives. Participants should understand the influence of conflicts of interest in medical education, know what the current guidelines and policies are regarding disclosing conflicts of interest, and understand the results of our study. And I'm hoping that this will generate some discussion because It's not entirely straightforward sort of interpreting what we found. So I just want to take a step back by way of background and talk about the types of relationships that may lead to conflicts of interest. So there are a bunch of different ones, and none of them necessarily they all lead to potential conflicts of interest, which doesn't necessarily mean they lead to behavior change, but that's kind of the way this works. So there are paid consulting arrangements. There are kickbacks, particularly related to use of products by surgeons. It doesn't really apply in the pharmaceutical industry. There are speakers bureau, kind of money for speakers bureaus. There are ghostwriting arrangements. There are payments for conducting clinical trials and even grants just to conduct clinical trials, which many people would not really consider a conflict, or certainly not a bad kind of conflict. And then there are acceptance of gifts and meals from industry, even things like pens and pizza. So there are a lot of potential conflicts out there. Next slide. So I think the important thing is to think about what are the potential harms. So I want to just give you briefly a little summary of what the literature shows in 4 different areas about the impact of these potential conflicts. So one is they can influence direct patient care, and I'll show you talk a little bit about that. They can influence clinical research and particularly recruitment of patients into studies. They can influence the medical literature and the publication of biased articles, and they can influence clinical practice through education, and that's what we'll spend most of the time talking about. So next slide. So for patient care, it's very, very difficult to study this, as you can imagine. So, what that would mean is like a doctor is paid as a consultant or even accepts gifts from industry, and those gifts may be something as benign appearing as a textbook or a pen. Does that influence patient care? So very difficult to study. It is clear that contact with marketing materials, sort of educational marketing materials and samples, have both been shown to influence prescribing. Not necessarily the quality of prescribing, but just to influence prescribing of advertised drugs. That's pretty clear in the literature. And there is some evidence in a systematic review, like sort of on the balance, it looks like it leads to poor quality of care, but that is by no means clear, I would say, from the literature. There is clear evidence of influence in publishing, and I think most people are probably familiar with that. This is an example from the tobacco industry, a sort of old study in JAMA, but it's really illustrative. So you can see here they looked at studies that evaluated the harms associated with passive exposure to cigarette smoke. And what you can see is tobacco-affiliated authors were much less likely than unaffiliated authors to find that passive smoking is harmful, and much more likely to find that passive smoking was not harmful. And this was highly statistically significant. And this has actually been shown overall. People have done reviews of basically studies in every clinical topic, looking at affiliations with industry, whatever the relevant industry is in that example, and have found that industry-affiliated authors are about 3 times as likely to find kind of in favor of the product, or in this case, not against the product, whatever the case may be. So there's clear evidence. Now, this may be for a variety of reasons. It may be publication bias, that they don't publish negative studies if they're affiliated, or it may be because of subtle ways that they introduce bias. But whatever it is, the stuff in the literature is different if you're affiliated with industry than if you're not. Okay, next slide. So moving on to research, it's interesting. In research, for obvious reasons, affiliation with industry can actually be a positive thing. It can make you more productive. You can have more grant money, obviously. But it also can inhibit collaboration. If those collaborations may have a sort of negative effect on the findings, and it inhibits people from publishing negative results. So in medical education, which is what I'm really going to spend the rest of the time talking about, it's interesting. There's very little direct evidence that conflicts really impact medical education, and it's only much more recently that people have become interested in this as a place where conflicts of interest might be influential. A lot of people, though, are concerned, and it's clear that industry is pervasive at all levels of medical education, particularly at the CME level, the continuing medical education level. There's been the most kind of obvious evidence of that. And everybody knows about these sort of boondoggle medical education, continuing medical education things in Hawaii where they're just completely industry-sponsored. And those are less and less because they're kind of cracking down on those. But it has been shown that industry sponsorship of those kinds of things leads to content bias, which I think is not surprising. Go to the next slide. So because of this concern, even though, like I said, the literature is not very complete in sort of showing what those biases are, a lot of organizations have expressed concern. So the AAMC and AMSA have both expressed a lot of concern at the undergraduate level. At the graduate level, the ACGME, which governs graduate medical education, has expressed concern about this. And at the CME level, the ACCME, which governs continuing medical education, has actually issued standards. And in fact, with continuing medical education, because I think the problem is more obvious at that level, the government has expressed concern, and a lot of the Institute of Medicine has expressed concern, in particular about continuing medical education. And there's been a lot of attention paid to this. So as a result, medical schools have implemented increasingly strict policies really regarding faculty interactions with industry, and particularly disclosing those interactions. And even there's been a movement toward a lot of more public disclosure. Go to the next slide. So why disclose? I mean, disclosure has been the cornerstone of pretty much all policies related to conflicts of interest. And, it's a given now in publishing that you disclose conflicts of interest. It's a given in continuing medical education that you disclose your conflicts as a speaker. In GME, more and more so, but in undergraduate medical education, a little bit less so far. So I actually want to, why do we disclose? I think everybody knows we're supposed to disclose. What is the rationale for disclosure?
To permit others to attempt to determine whether anything has influenced what you said. You can't do it absolutely,
right,
but just to raise red flags.
Right, exactly. So one reason for disclosure is that so the listener can listen to the information knowing that you have this conflict and sort of change the way they approach it or approach it with that knowledge. And then there's probably another major reason. You think that's the major reason? Right. So there are reasons from the listener perspective and from the speaker perspective. And also I think it's supposed to make speakers more honest and maybe even refrain from having certain conflicts which are more egregious. But that certainly they're aware of their own conflicts. Because these things are all subconscious. I mean, very few people, in very few settings do people give a talk and say, oh, I'm going to sell this product through my talk. I think most of the time people are totally honest and that these change things in very subtle, subconscious ways. So it's making people aware of it when they're speaking. And making listeners aware of looking for bias. There is absolutely no evidence, just so you know, that either one of those things happens. So I'm going to go to the next slide. So go again, So this is the evidence, this is what we know about disclosure, and this is really why we did this study. So in the social psychology literature, this is very, very interesting. There is some evidence that disclosure has a perverse effect on the way listeners hear information. That it leads to people being more trusting in the speaker than if the person does not disclose a conflict. People have postulated this because, the listener thinks, oh, well, this person's so honest that they must be presenting information honestly if they're telling me they have this potential conflict. No one knows why, but there is some evidence for a perverse effect on listener attitudes toward the information. In publishing, though, it's sort of the opposite. If you publish in the written literature, and I think it's very, very different when it's something written as opposed to somebody's face in front of you or even somebody's voice speaking to you, but in the written literature, there's evidence that if people disclose a conflict, the reader will sort of value that information in that paper less. So that's, or be more critical of it. That's probably what should happen. And in publishing, it does happen. In continuing medical education, there's evidence that what you said doesn't happen because people just can't do it. So people have very little ability to discern subtle bias related to conflicts of interest. And that doesn't surprise me, actually, but that's, we're relying on people to be able to discern. And again, the bias is not obvious. It's always subtle, pretty much. And people don't do that well. Okay. So in undergraduate medical education, there's been more and more of a movement toward disclosure nationally. But nobody has any idea what the impact of that will be. And actually, I'm going to go to the next slide because I think this is not my next slide. No, go back. I'm going to say as an aside that there is evidence from other parts of the literature that what happens during medical school is that students become more and more accepting of industry. And actually, Matt Fitz, do you remember this? A couple years ago did a study of this, sort of the hidden curriculum in medical school, how students, as they march through medical school, become more and more accepting of industry relationships. So I have a slide about that later, but I think it fits in better here. So all of this kind of movement in the world at large caused a policy change here, which was really David Muller's doing along with Azalea, I believe. It was sort of the two of you kind of pushed that. And so there was a new policy starting the last academic year that all lecturers to undergraduate medical students would disclose their conflicts of interest in every lecture and actually make those conflicts available online. And because of the complete lack of evidence on what disclosure actually does for people's attitudes, we took advantage of this kind of natural experiment to study the impact of the new policy. So that's the data that we're going to show you today. So this is an example of the disclosure slide, and all lecturers in the medical school for the first 2 years were supposed to begin their lectures by showing this slide. And that's what it looks like. And then the next slide shows you what it looks. Oh no, it doesn't. I guess I have it later. I'll show you later what it looks like online. Okay, go to the next. So the objective of our study was to look at the impact of these routine conflict of interest disclosures to medical students on their attitudes toward disclosure itself, the importance of disclosure, and interactions with industry in general, to see if this would have any effect on kind of the hidden curriculum. Next one. So the intervention was mostly what I told you, the slide at the beginning of every lecture, and the availability of that information in an online database. We did not really enforce it. I mean, that was not part of the study. We didn't harass people about having the slide there. We didn't double check to see how many people did, and we did not check the information on those slides. So this was just asking people to do it. In addition to that, there was an introductory lecture that I gave, about 20 minutes, where I did a little sort of background about conflicts of interest and relationships with industry, and I basically just oriented the students to this slide and told them you're going to be seeing these slides. I did not tell them any information about the fact that we didn't know what the impact of disclosure was. I mostly just talked about what the guidelines are and how it's considered important to disclose. And that's considered part of the intervention, but I can tell you that I've been giving that almost exactly the same talk for several years now, ever since our Attorney General grant, because that was part of what we had proposed in the grant, that we would educate students about this stuff. So I changed the talk very, very little from the year before to this current year. So, I mean, I kind of have to be fair, consider that part of the intervention, but really it's no different than what everybody had gotten before. Okay. So here's a sample disclosure. I can tell you that looking through them to try to find one for this talk, the overwhelming majority of them were negative. It just said I have nothing to disclose. I mean, I had to really dig to find one that actually has something. I don't know whether those are honest, to tell you the truth, because there were some individual lecturers whose name I knew, and who I knew to have other conflicts other than what they disclosed. So we also ask people to disclose conflicts that are relevant to that talk. So that requires a lot of judgment. So right or wrong, I can't vouch for the accuracy of these. So if you go to the next slide, you can see what it looks like. So basically, people check if they have a conflict, that they have one, and that it basically gives the name of the company and what the sort of content of the conflict is. This person actually had 3 others, which I couldn't fit on the slide, so I just showed the first 3. Okay, so that was available to the students. So in terms of the way we evaluated this, we surveyed medical students with a survey of attitudes toward industry, which was based on a study that we published, our group here, but it's also very, very similar to a survey that's been used multiple times at different levels of training. It's been very similar things been used in medical students. It's a pretty standard thing, pretty well-validated survey. I'm going to sort of show you a graphic which shows the study design because it's a little bit confusing, but we administered the survey at the beginning of the year to all the first and second year students, and then again at the end of the year to all the first and second, or most of the first and second year students. The survey contains 14 items, all of which are on a 4-point Likert scale that look at the appropriateness of gifts to physicians, that's one of the domains, appropriateness of industry-sponsored education, so things like grand round speakers, things like that, the impact of relationships on the quality of the teaching by academic faculty, and basically the role of disclosures. Those are the areas that we ask people about. And this is what the survey looks like on the next slide. So it's just on a 4-point Likert scale. Strongly agree to strongly disagree. Next slide. So that's what I talked about before Matt Fitz's work. So we made 2 comparisons. we looked at pre-post, and actually the first and second year students' pre-attitudes there were no statistically significant differences. So for the pre-post analysis, we pooled first and second year students before the intervention compared to first and second year students together after the intervention. And we also compared the end of the year first year students. So essentially those people had 1 year of medical school training and exposure to this intervention, compared to the beginning of the year second year students who were a year ahead of them, who also had 1 year of medical school training, and there were no major changes in the curriculum with regard to any of this stuff. And those people had no exposure. So that was just another way of comparing sort of unexposed to exposed. It's not randomized, but we have no reason to believe that the students are vastly different from 1 year to the next and that the attitudes are likely to be very different.
The only question relative to this would be that probably a lot more stuff of that clinical utility is in the second year curriculum than in the first year curriculum.
Mm-hmm.
And therefore, perceptions might be different. And I wonder whether by pooling, just because their initial response was no different, I wonder whether something might be hidden.
Yeah, that's a fair criticism. I mean, I think we really looked for things that were the same, where we had the same findings in the two analyses, which really gets rid of that problem because it compares only people who have only had 1 year of medical school. But you're right. I mean, there certainly could be other things going on in the second year. I can tell you that the first and second year students on the post actually were not all that different either, but there certainly may be things that we're not seeing there. Okay, next slide. So this sort of shows you, what happened to my first year? You can't really see the first year students. So I tried to make this darker as we're going through medical school, which means you can't see the first year students. On my computer you can see it, I assure you, but you can't on this. So essentially we had first and second year students exposed to disclosures. Next thing. And then we administered surveys at the beginning and end of the year to all those students. The first analysis was pre-post, like I said, where we pooled first and second years and first and second years before and after exposure to all these conflicts of interest disclosures. And then go down. You have to go down a couple times. And they're moving side by side. So this is supposed to show you the continuum of education. So then we looked at people who had received 1 year of medical school, either at the tail end of their first year with having received the exposure, the intervention, or 1 year of medical school not having received it. That's the second comparison. All right, so I'm going to turn it over to Andy to present our results. So these are now the survey results in those two analyses.
I saw my professors do this all the time, and every time it seemed awkward. Now I know why. So yeah, I get to talk about the results section. First, just our response rate. For the first administration of it, we got relatively equal amounts, 66%, just about in both classes. And the second administration at the end of the year was closer to 60%. Maybe they were tired of us. Maybe they stopped going to mandatory things. Who knows? But we counted the denominators, everyone in the class, because we figured they could be at the meeting and available to take the survey.
Yeah, I didn't actually do that. We administered the survey that quote mandatory meetings in each class. But mandatory as well.
Plus minus. Okay, so the first domain we talked about was acceptability of gifts and other funding dispositions, and the first question really addressed that head on. This graph is showing what percentage of students either agreed or strongly agreed with the statement. The first statement is acceptable for physicians to receive gifts and lunches from pharma or medical device companies. And in the blue we have the pooled pre-data, everyone at the beginning of this before the intervention. And it was relatively unpopular, around 40%. And after a year of disclosure, it went down to about 34%. Not a statistically significant change, but it became relatively more unpopular. And this is consistent in both of our different analyses. Second question was asking about the effect of gifts on physician practices, whether or not receiving gifts or food or other compensation would change one's prescribing, or one would be more inclined to prescribe that product. So right off the bat, 70% of the people either agreed or strongly agreed that affected one's behavior. You're more likely to prescribe something. And in the post-survey, almost 80%. We're really close to statistical significance in this one. Yeah, it's a bit outside at 0.052. But in the other analysis, the one where we took the first years at the end of year disclosures and the second years at the beginning of second year, it was statistically significant in that direction. And finally, just asking whether or not funds were appropriate to use or useful to use for funding medical funds from pharma and device companies were useful for funding medical school activities. First, everyone, it was a small majority that was in favor of this. It was 61%, and this was a significant change. Went down to 44% agreeing that this was useful, effective. And while that's not some raging majority that now finds this completely unacceptable, it is a significant change. And once again, this one, that was also found in the other analysis. Okay, moving on to the next domain. It's about what kind of contact is acceptable between industry representatives and folks in medical education. And the first question, whether or not the school should prohibit device and pharma folks from meeting with medical students. Well, people were kind of tepid at first, slight majority stating that this policy was right, that they should be banned from speaking to us. It goes up to about 72%. That is statistically significant in both analyses. Whether or not the school should prohibit industry folks from meeting with our med school educators, only 40% people agreed with that in the pre, and we have a slight majority in the post. So once again, we don't have this raging majority that is now outraged, but we do have a significant change from pre to post. And finally, our school should prohibit industry folks from meeting with house staff. Once again, about a 40% agreement rate pre, and we got just past the midline. We've crossed the midline for post. So these are all significant differences, significant changes, but not a huge majority. The third, whether or not people's opinions about industry-funded educational materials, it's pretty much stayed the same from pre to post. Whether or not educational materials from device companies were useful, about 3/4 said yes first time around. Not the same for the second time around. Not statistically significant change at all. Whether or not pharmaceutical company materials were useful, about 70% in the pre and 63.5% in the post. So there's a slight change there, but it's not statistically significant. When I looked at this, my interpretation was that in the first and second year you're really not exposed to any of these things. So I personally was too surprised that there wasn't a huge difference here. There might have been a slight trend towards disapproving of these. There was a larger one in the pharma one, which I know was specifically mentioned in the COI lecture they were given at the beginning, but again, not a huge difference here. Sure.
I don't know how the questions were worded, but it's sort of interesting that a much larger portion of the students think the materials are useful, and now you go down to should we be exposed to them, and you have a huge bunch of people who say absolutely not. How do you? Precisely when they haven't been exposed to them. There's nothing, there's not very much experience, but I think this is useful, but they should be prohibited from contacting medical students, or they should be prohibited from contacting faculty. It seems that those two things are paradoxical in the way they're responding, unless in your intro there was a difference between a drug rep as a person and material that's, written material or other things that are provided by pharma. I'm not sure.
Yeah, the intro was very, very big picture. I really didn't speak specifically about kind of anything. It was really just what are the guidelines, why do we have these guidelines, why are people concerned about this issue? And I can tell you that I'm quite sure, I'm a decent speaker, but I'm quite sure that my speaking to them for 20 minutes had very little impact on anything. Because we all know that whenever you speak to anybody about anything for 20 minutes, it has very little impact on anything. So my personal opinion is that their exposure every day, every lecture, to just this reminder is actually the thing that accomplished whatever it accomplished. And I do think it's interesting. They don't know what this means. Sponsored materials. I don't think they have any way of knowing what that even means. But it was part of this. Well, it was part of the instrument, and also it's almost a control question in a way of, we're not doing anything with regard to this. And one of the interesting things about this, I think, which we can discuss at the end, is it had much more of an impact on their general attitudes than it did toward anything directly relating to disclosure, which is what the intervention was. But I mean, I don't really know why there's a difference there.
The only thing that would make this more valid is if you give it to them, the same group at the end of the third and fourth year.
Well, that's what we're going to do. That's what we're going to do. But and also I can. Yeah. I can tell you that in the control. You have to remember that the control group in the other analysis, the end of first years versus beginning of second years, that control group got a lecture from me also. You know, those second years got a very similar lecture from me during first year. So I mean, whatever it is, it's not my lecture.
It's not even the question of the lecture. It's not the difference between the before and after, but just the absolutes on both of them are so very different, and they don't match.
Yeah. I mean, I think they probably think differently about a person interacting with them than materials, is my guess, but it's a guess.
Okay, and the last domain is more about educators and conflict of interest disclosure and what effect that has on opinions or what the medical students think was appropriate. And the first question or statement to be agreed with or not was the content of lectures at our school are evidence-based and free of bias, regardless of whatever conflict of interest that our professors have. And both pre and post, there was very solidly in agreement. About 3/4 of folks believe that our lectures here were free from bias. Second one, asking about students' opinions towards content and lecturers who disclose conflict of interest, whether or not lecturers who disclose are less likely to present biased material. And once again, both pre and post people agreed with that statement pretty resoundingly, just about 3/4. And finally, the last statement, the quality of education at Mount Sinai is not influenced. The quality is not influenced by any relationships that an educator will have with industry. And it's consistent from pre to post. It's about high 50%. I was a little surprised that it is different from the first question. It is, and consistently so. That students were fairly confident that the content of the lectures was free from bias, but the overall quality they seem to rate lower.
That may reflect stuff going on other than lecture.
Yeah. How do I interpret the 25% who think that the content of the lectures may be influenced? Okay.
Quality of my education is not influenced by any relationship, blah, blah, blah. 40%. Am I wrong?
Correct.
It says it was influenced.
I think Dr. House has raised the point that it could be. Oh no, and forgive me if I put words in your mouth. That there's learning outside of the lecture hall, and it's not, yeah.
Or the first two is lectures, and then globally the last question could be your clerkships, your preceptors.
Or it's a bad question because there's not in there. So I think it's possible that people misunderstood that. I think the first and second question are actually better questions as questions go.
It is first and second year, but there are a lot of small group stuff that's not lecture. And so there are lots of times when many faculty might express things that students feel are biased, but they didn't show up in lecture.
Well, they think there is. They think there is.
How the question is written is really important one because with these types of questions there's a lot of post desirability. Students are smart, so they sort of know what the right response should be, even if they haven't been exposed to it. So that's probably a critical point.
All right, sure. There's one final thing, just dissecting the data down a little bit for that first question again, lecture content. Deb Korenstein mentioned earlier that there may be a perverse effect to conflict of interest disclosure, and we saw this relationship, and it may reflect some of that, or be an interesting point. That in between the pre and the post, if you look only at the folks who strongly agreed that lecture content here kind of was evidence-based and there was lacked bias, it went from 9% to about 19.5%, which was a significant change. While the overall agree and strongly disagree numbers didn't change much, people seem to more strongly believe that our content was evidence-based and bias-free.
I think the discussion of this stuff's really interesting. I have to say that I expected this study to be totally negative. I honestly expected us to find absolutely no changes. So I was very surprised, and I kind of wanted to. I wanted to be able to say, "Oh, look, disclosure does nothing." But that's not what happened. I think what we where is it down? That's the limitations. I think to summarize what we found is this intervention seemed to change students' overall attitudes toward industry, toward sort of the appropriateness of interactions with industry. Those were the things that changed significantly. It did not change their attitudes toward doctors with relationships to industry, or at least not in their own experience. So they trust overall, for the most part, they trust the doctors who are talking to them, but it created more negative attitudes toward industry, which I'm really not sure why that is. And I think this was a borderline statistical significance, and it was sort of a very secondary analysis. So I wouldn't hang my hat on this, but I think there's certainly a suggestion that perverse effect of disclosure might be at play. So there were many limitations to this study. This was sort of a natural experiment that we were taking advantage of. So we used two different quasi-experimental designs. So both pre-post and the sort of comparing the first and second year students are both quasi-experimental and certainly have bias. It's not a randomized trial. We couldn't do that. There are a lot of unknowns. We really don't know how many of the lecturers actually showed the slide. I was at a Department of Medicine grand rounds a few weeks ago, which some of you might have been at, where a speaker has many very, very relevant conflicts of interest, and she basically sped right past that slide. She had her title slide, and then she went click, click, and her disclosure flew past. And I nearly had a stroke. But, so I don't know. We don't know what happened with these slides in the lectures. We don't know how honest people were in disclosing their conflicts at all. That was not part of the study. And we don't know if there really was any bias in any of the lectures at all. That's, it's very, very difficult to look at. The thing that you'd want to look at to really study this is look at a lecture with bias, with or without conflict. With or without a disclosure of a conflict of interest, and see if people can actually be more suspicious. But it's very, very difficult to do that. You can't, randomly assign lectures to having bias, because then you're teaching people bad stuff. And to pour through each lecture and try to find subtle biases is just not doable. So we couldn't really do, and nobody can do, which is why there's no real literature on this, the study that really would answer the question. So this was sort of a surrogate. We don't know how much response bias was present in terms of what the students thought we wanted to hear, and I think that's a distinct possibility that there was some of that. But I think the things that changed, there's no reason to believe that would change from our pre to post survey. So I think that doesn't particularly impact the things that we found to change, but it may impact the raw numbers. And you have to take the raw numbers a little bit with a grain of salt because of that. Probably not. I honestly can't remember. I can't remember if I mentioned any of my own work in the introductory lecture. I don't think I did, because I didn't really talk. I really talked about the guidelines more. So I don't think that I mentioned. I don't think they'd have any way of knowing that. So I doubt it, but I can't be sure.
And they didn't find that out right before they had to complete the survey.
We know what's very interesting is, for many of them, we wanted to get the surveys done before the introductory lecture. Many of them actually completed it after, and within a week after, which, if anything, would have biased our study toward not finding any difference pre-post, because they would have had more social desirability at the beginning, having just heard my lecture, and said all these negative things about industry. And we found, the opposite, that they were more negative at the end when they hadn't heard from me for 10 months. So that might have biased it, but I think it biased it against our finding any differences pre-post. Any other comments? You can't. I don't know. These guys, Azalea and Andy, like harassed them to try to get them to fill it out. I don't know.
Part of this depends upon whether the students actually went to lecture, and it's clear from many lecturers, especially in the second year, that there's less than 60% attendance. So if you were going to ask them again, it would be important to say what percent of lectures you actually attend. And you get some sense of whether some people went to no lecture, and there's not going to be a difference because there's no intervention.
Right, so again, that underestimates, I think, the effect of the intervention. Yeah.
I have a question, something that wasn't mentioned, but personal experience dealing with this. And that is, when I was asked to fill out, I guess it was on WebED, the form, there were 2 paragraphs that I cannot agree with and therefore refused to sign the form. Paragraph or one statement said, if any drug in a group, I don't remember how it was in a class, is mentioned, you must mention all drugs in the class and discuss their relative risk-benefit.
Really? That was on the form?
If you mention any trade name, you must mention all trade names of related drugs. And I don't know whether I'm getting the same form that somebody else is, or whether I was getting a form that was for CME, but both of those were on there.
This is our form. This is the form for the students.
It was that kind of form. Yes.
I mean, for the student lecturers.
There was an affirmation of both of those 2 things on the form I was asked to fill out. And I thought it was inappropriate for second-year pharmacology.
That's really...
To mention all drugs or all trade names. And somehow we couldn't figure out where that came from, but somebody just told MedEd office to stop bugging me about it, and that's where it is. But I think...
That surprises me. I mean, I'm...
My name is the Mountain Tricia, and I'm the director of CME, Alfie. And on our disclosure form, there is a question that does pertain to whether you're going to be discussing unlabeled or investigational uses. That's on here.
Yeah, that's a standard. I mean, that's on every disclosure.
We don't enforce that you have to, there's no mention that you have to mention.
I've never seen any statement like that on a disclosure. I mean, I don't know if it's certainly they're trying to drive you out of the medical school, maybe. I can't speak to that. I have no idea where that came from and whether that was like. That wasn't. This is the standard form, so I mean that was not on everybody did not get to that level. That's all I can say.
And do you know if there is any other curricular or paracurricular activity that relates to this at all? In other words, are there any small group cases that are used where there's a discussion about pharmaceuticals, maybe in the epi-biostat course, or I mean all over the newspaper in the last year or so.
Yeah.
A multitude of articles.
There is the Viax case that Joe Ross and Salome Kayani developed actually for the AG grant that I believe is still being used. So there is, and that's an epi-biostats course, right? So there is one case in the epi-biostats course, and that's it.
And in ASM 2, there's at least one small group case where we talk about conflicts of interest in patient care. And I don't think it was specifically like, pharmaceutical or device based. I think it was some other conflict of interest, but in that way it was.
One of the meetings that I've been to, I guess there is a change in the rule about what has to be disclosed out for our institutional point, or for research, or... Yeah, that's for the website thing. Well, the way that we change the annual reporting form for faculty, we structured the questions differently, and we structured them differently on the research form. The forms used to ask whether or not you had a conflict, and the conflict really shouldn't be determined by the person who's the form, because they're going to say, oh, well, I don't have a conflict. So we changed our questions, and they're similar to the way you're phrasing here. They should really disclose what their financial interests are. So they disclose what their financial interests are, and then we determine whether, or a committee determines whether or not they have a conflict. So is that I guess because as it evolves, it sounds as though the question is of people's perceptions of their conflict
Mm-hmm.
going to change.
And maybe they shouldn't be deciding whether or not they have a conflict. They should just tell us, this is what I have, this is everything that I do, this is what I have. And then there should be an independent assessment of whether or not that's creating a conflict.
That can be a little bit difficult because the question of whether that's creating a conflict may depend on what specifically they're talking about, you know? So somebody may have a conflict with regard to some very specific issue.
And that's probably why a lot of the forms that you're receiving that they say no.
Right.
Because they do have a financial relationship with the company, but they feel that their financial relationship isn't relevant to the talk that they're giving.
Right.
So you could look on their faculty profile page on the school's website and see if they have a relationship with a pharmaceutical company or a device company, but that relationship they feel is not relevant to the talk that they're giving, so they're going to answer your form
Right.
no.
And that would provide, if you ever decide to do another study about assessing that, comparing.
Right, look at the accuracy.
On the website and what they're
Yeah.
disclosing here.
Well, what I'm thinking is if we're going to have a database for students to access, why not just let them access the faculty disclosures that are institutional-wide, institutional disclosures?
Faculty disclosures have compensation amounts in them, so they have relationship-based compensation amounts. They have, if they have equity in a privately held or publicly held company. So there's limitations on what we grant access to. So even if you look at our public, if you look at the faculty member profile page and look at the public disclosure, we do not publish any dollar amount. We just publicly disclose what type of relationship they have, what companies they're working with. So we try to limit although.
But we could let the students link to that. Right.
Look and put in a document.
Yeah, that's public. Yeah.
But right now we're working under keeping as much information as the faculty report as confidential, but also publicly disclosing what we feel is important for students.
Mm-hmm. Okay.
So two things. I think that related to the question that's disturbing, which is that a lot of them believe that somehow their medical education is altered or biased, needs exploring.
Mm-hmm.
And certainly if you're going to do this again early on, ask them where they think that bias is occurring and with whom. And then at the end of their third or fourth year, ask them if it is occurring. So you can get some data on that. But then the bigger question is, what are you going to do to try to disavow them of that notion if in fact we don't believe it's happening?
I think there are two different issues here. We don't know if it's happening. We have no idea. And I mean, this came from some egregious examples where there was bias. I mean, that's sort of what led to this, some local and I totally believe that those are few and far between, but I don't think, I think the problem is it's very difficult, if not impossible, to actually figure out how much bias there actually is. So I don't know how to, disavowing them of that belief might be appropriate or it might be inappropriate. It's hard to know. I hate to say that to all of you, but.
Is there any question on healthcare and this questionnaire on evaluation of your education that has anything to do with COR with the two clients?
That's interesting.
Still am trying to puzzle out whether sleeping dogs lie applies to deceit or posture. I say that.
I just thought it was cute. You're thinking about it way more than I did.
You meant double entendre.
Yeah.
But in that respect, thought, and I'm not sure that this is true, there were plans to ask the pharmaceutical companies to report their content.
Yeah. Yes, absolutely.
And have they been aired or compared in any way from outside up?
I don't know. Not that I know of. That,
We have a little disclaimer on our company. Disclaimer in the relationship that in fact did not exist in Israel. The company was stating a conflict that in fact did not exist. So
yeah.
both ways.
I think it's complicated though because we should be able to. It sounds like we can't, but we should be able to check whether people's disclosures are accurate. So if they're disclosing to the institution, these are all my relationships. In a perfect world, and I mean, probably they'll improve this process because this has just sort of started and just got kind of dumped out there in the last couple of years. We'll be able to do that. It's still hard to know. The concept, I mean, the standard right now for disclosure of conflicts with regard to educational materials or paid publications is that you are asked to say whether that is relevant. And there's still that completely subjective component of somebody deciding whether it's relevant. So all the public disclosure in the world is not going to fix that. People may say, well, I got $1 million from Merck, but it's not relevant to what I'm about to say. So, I mean, I don't know what to say, but that's the standard. I think it's probably not a good standard. I mean, I think it's probably better to just disclose everything and let people be the judges, let the listener be the judge of how relevant it is. But we also know that listeners are poor judges of that. I mean, I think it's a very interesting thing, and I think this study is really interesting because disclosure is everywhere, and like I showed you, people know so little about what it means to disclose and how important it is. I mean, my personal opinion is that disclosure probably doesn't accomplish much of anything, and we're spending so much time worrying about disclosure, and I don't know how much it really is going to change whatever bias is there. I think it's almost unrelated to the bias that's there. And also many people have bias that's not due to financial relationships. They just have cognitive biases based on whatever. It's human.
Yes, we're around that slide because the department also mandates allows people to say the standard joke. Yeah, I have nothing to report this time, but I hope to have.
Right. I've made that joke myself. So, to me, the interesting thing about this is, number one, I think that it shows that seeing something every day has an impact. It may not have the impact you plan for it to have, but that's the way to change things in education. It's like to show people something over and over and over and over again. I really don't think that my 20-minute talk did change anybody's mind about anything. People who agree with me say yay, and rush up to talk to me at the end, and people who disagree close their book and leave, and that's the end of it. But I think that showing people these disclosures had some impact. It may not have been the impact we expected or desired, but it had some impact.
I would think that the impact we wanted was actually that they are more aware of and think of more often whether or not there is bias when they're learning.
Yeah. I think honestly, this is, where is it? This shouldn't have been impacted, really. We didn't address that at all. Really, this maybe, it's sort of a general attitude. It doesn't really have anything to do with what we did. But this is the thing that maybe we most directly addressed, and it had no impact. Yes, but I've done that for years. For sure I've done that for years.
That's what astonishes me about the disagreeers.
Well, they could still think that they may just think that, my lecturer is a good guy, and he may have a relationship, but it's not impacting the way he teaches me. And the Sinai policy is that you can have relationships, but you have to disclose them. So I don't think that's necessarily contrary to Sinai policy. But it's interesting. I was very surprised by these results, I have to tell you.
In my mind, what you really want are two things. You want the students to not be individually biased by information or aware of bias in information that they're receiving, and also to, I guess that's both of it, really. In others when they're receiving it, and not to be biased in their opinions about what they're doing or teaching others.
Right.
Which doesn't necessarily relate to what the teaching's global attitudes are.
Right. No, I agree. I totally agree.
It's their behavior that you'd like to change, or their awareness of it, as opposed to their attitude about what exists around them.
Right. Yeah. I think, though, that this may be, and I didn't really get to my conclusion slide, this may be something that blunts the hidden curriculum, which would be very interesting. I mean, if we find that as we follow them through, if we find that it blunts the hidden curriculum, I think that would be quite interesting. We don't know yet whether whatever goes on in the clinical years will override this, which it might. But that I think would be quite interesting. I mean, I think what I would like people to do, and this also ties into the fact that I teach evidence-based medicine with a lot of my time, I would like people to actually weigh the evidence that they're being shown, know whether there's inherent bias in the way it's being presented, and see through that bias to what the truth is. But that's a very tall order, and very few people can do that. Very few doctors in practice can do that. I mean, we know from the CME literature that doctors can't do it. When you show them biased material, they don't know that it's biased. So I keep pushing that rock uphill. But I just think it's quite interesting what we did change. Thank you.